Brutus.
Hello, I'm here for the webinar today. I'm going to be helping out.
Okay, hi, I'm Dr. Narda Robinson with CuraCore Vet and CuraCore Med. And today we're going to talk about 3 ways to jumpstart your veterinary career after COVID. So, as we're embarking here, I just want you to think about where you are in your career. Maybe you're a veterinary student, maybe you've been out for a while, but the real purpose of this discussion today is that I want you to know that there are ways to do veterinary medicine that you might not have heard about in school or have been recruited for or anything. I got the idea for this talk today from an article in today's veterinary business. It's put out by NAVC, and it's called How the Big Dogs Recruit. And it says corporate owned hospitals know what is needed to attract top talent. Private practices looking for veterinarians can compete with the giants too. So it has 9 different ways to help the private practitioner get at the same group of candidates that the corporate is after. And they include things like advertising. So, corporations are spending big bucks on advertising with job board posts and trade show booth space and all that. Then go out to veterinary colleges. So, meet the students, get them early. So, if you're a vet student, that might be something that you've seen is it used to be like getting into the military. They used to come and tell you all the great stuff. But, another impetus for me to do this is that there are so many people that have been unhappy once they get into corporate world or a big practice, and there's just so many other options that you have. And so today is a way to encourage you to not sell out and to follow what you really want to do with your life, because we don't know how much there is after, and you spent a lot of time getting where you are, even if you are older. And you should be happy because there's plenty to do that will make you happy. Um, just some other things, signing bonuses, competitive compensation and benefits, time off, high quality medicine, blah blah blah. But when you look, as we will, at some of the information, such as the Merck AVMA study about veterinary well-being, it's like there's a mismatch between all this talk and what veterinarians are actually experiencing, which is where we get to the point of um, burnout, depression, and suicide. So let's get started now. Great to see these questions coming in. I'm disillusioned with veterinary medicine. What is the first step to be happy again? I think you just did it, knowing that you're disillusioned. And I'm not going to give you a pep talk to say you should be meditating, you should be having lavender aromatherapy, spend some more time alone in your day. There's actually the big, so to speak, elephant in the living room, which is the veterinary profession itself and what has happened, and seeing analyses like when veterinarians don't own their own practice or don't have the ability to guide what they're going to say, when there's corporate dictates on what you're going to do, when you get protocols and you have to do this, that, and the other thing. Um, there there's now objective evidence about why you are unhappy, and yet so many of the companies that are analyzing it aren't saying anything about, let's look at the career itself and what you're being asked to do, and why you're not happy. So let's get started with this. And um, and we are in this interesting and sad and traumatizing and chaotic, but also an opportunity type of situation with what's going on now, which is the COVID-19. And a lot of us are on stay at home orders, or maybe you are still working in your veterinary essential business and getting some things done. But if you've had the chance to reflect during this time, you might be not looking forward to returning to corporate. You've maybe had some time to be with your family. you've had the opportunity to sleep later. You're out of that kind of, hamster wheel going around all the time and getting to a point like, what do you really want out of life? And just some hard questions like that. So, if you're not ready or willing to get back to that grind of the busy, high pressure career in corporate or big veterinary practice, we're going to talk about what other things you can do. And I think it's wonderful, as this first questioner asked, I'm disillusioned with veterinary medicine. What is the first step to be happy again? I mean, we could ask what disillusions you? And to me, even thinking about being a veterinarian, so that would be in the 60s when I was 3 and 4 and first had a cat and all that, that um, there was a different way of practicing back then. And yeah, there's been some improvements since then, but it was a much more personalized experience, and it wasn't just an sort of anonymous kind of big box practice. And I think that's part of what is getting to people now. So are you disillusioned with the way that veterinary care is being offered, with um, how you're pressured to make more sales, whe- where you don't get the time to spend on, let's say, acupuncture treatments? So let's look at that some more. And we're all hand washing a bunch more, but do you want to wash your hands of where you've been and start over? And I encourage you to, if you are unhappy, you have various options, and there's a lot of them. And one of the things too that has stimulated me offering this brief presentation is that we've been teaching through Curacore medical acupuncture and related techniques for over 20 years now. And so we have seen it year after year, session after session, how people arrive to our program, whether they are early or later in their career. And yes, somebody asked, "Are you too old to go to vet school?" No, not at all. And this type of medicine that we teach works great for people at any stage of their career. But they come into the group at sort of a crossroads. Maybe um, they've been just out of school, and they are fed up with, oftentimes this happens, that they have had a dog, let's say their own dog, that this is a frequent one that I get because I'm so anti TPLO, and their dog was lame, and they went to the orthopedist or somewhere inside the school, and this doesn't happen necessarily everywhere, but that they were told, you need a TPLO now, you better plan for the other one. And they might ask, because usually I know them because they're in an integrative medicine club and I've been visiting them, but they might say, well, what about rehab? What about acupuncture? And if the surgeon does not know or care about non-surgical techniques, then they might say, no, you need to do this. And what's worse is some of them will say, you need to do it now, or terrible arthritis is going to set in, and with the implication that you're morally irresponsible. And so when they ask me, if again, if I'm lecturing there and visiting, I mean, it must happen really a lot because I get the question so frequently. And I say, first, is cruciate disease an emergency? No, especially in dogs. It's a longstanding problem. Um, and what's going to hurt if you go and um, and pursue integrative medicine and rehabilitation instead first? It's not an emergency. You can do these treatments first. Why don't you do that? It'll also be a learning experience. There is never an emergency to have a TPLO. And once you deform the leg in that way, it will never be the same. But that's just this one example. So, how did veterinary medicine get here in the first place, where so many practitioners are burnt out, depressed, and suicidal? Well, if you don't know, um, or if you don't have the opportunity to give somebody, let's say this is a dog, okay? If you don't have the opportunity to give other options, and if you are in a corporate environment where they are pressuring you to make sales. So, right when I was out of school, and one of my best friends from my class, she went to another practice, and they say, push the products, whether it's flea or whatever it is, push the products, push the procedures. And more recently, recent graduates have complained that they go into a big corporate chain, and you're supposed to meet a minimum of selling them $700 to $800 worth of lab tests and whatever ancillary things. That client should not leave without way overblown amount of tests and procedures or whatever it is, that their bill should be in the several $100s. So no wonder there are things that happen that cause the clients to get upset, and especially nowadays with so many people out of work and desperate, and and just unable to afford it. Now we're even more starkly looking at the distinction between life and death. That if people don't even have $400 of spare cash, so to speak, that they can spend, then how are they going to afford a multi-thousand-dollar procedure? Or why should they invest in all these tests that their animal doesn't need? And then you get stuck in the situation you were lured as a student, perhaps, to go into a big corporate practice or whatever practice it was, and you were given a lot of sales thing, just like join the military here, join our practice. We'll give you $20,000 because aren't you upset that you're in so many hundreds of thousands of dollars of debt? So we're going to give you $20,000 bonus. We'll let you take CE for a week. We'll give you 2 weeks off. We'll give you 100,000, whatever it is. And it's like, to a student, probably that looks pretty good. And you haven't maybe heard that there are lots of other options that you can have, because it's just like with the pharmaceutical companies. Who gets to you? Who is there, detailing you, giving you all this nice fancy literature, giving you videos that say how happy everybody is there. When if you look a little bit more deeply, there's a reality there that it's like that's going to burn up your soul potentially. There's probably places that are okay and good, but there's even another option that you should be able to consider, that you should have learned in vet school, that you should have seen people role modeling for you in practice. And I will point you to videos where we can show you people that are involved in our course and that have come back to teach year after year because they have found a way to practice where they have time off. They have the ability to be with their children when they want to, where you determine when you're going to start work in the day, when you're going to stop, when you take whatever time you need because it's your practice. And it doesn't have to be full of surgical and anesthesia and radiology overhead, which is like 80% of the overhead. So, um, so here is another question. I work for a practice that is very surgery oriented, and I don't agree with it, but I need to pay my student loans. How do I work under these conditions? I couldn't work under those conditions. If I was being pressured to, take a dog's limb because of a ligament and cut the bone and reposition it and do all kinds of other things. I wouldn't. I never plan to refer for a TPLO if I was told I had to, because it's so much money and people make a lot of money on it and a lot of people thoroughly believe in it. I couldn't do that, and so that's where you get more into this idea of moral injury as a cause of burnout. When you are being asked to do things that cause cognitive dissonance and that just get to your heart and you don't think are right, then that's going to wear on you and it's going to burn you out. So how did veterinary medicine get here where we have such an epidemic of burnout, depression, and suicide? So this study back in just late last year, and it's been published this year, by a joint effort by the American Veterinary Medical Association and Merck. It looked at job satisfaction, compensation, burnout, substance use disorder, cyberbullying, typically by clients or whatever, that aren't heavy, and suicide among veterinarians. And there's a link there that just talks about it, and that was written by Merck apparently. But you can find the actual studies online, and we have been publishing handouts on this for about 8 months now. We've put out handouts on suicide and burnout and depression, and what else you can do with the pain rehabilitation and integrative medicine pathway, which is the PRIMA pathway and certification from CuraCore. It's our antidote to this medicine that is so heavily and unhealthfully dependent on surgery and invasive procedures. So, what they found in this Merck study was that the suicide rate among veterinarians is higher even than physicians, which is already very high. And female veterinarians have a higher rate of suicidal ideation than their male counterparts. And though male veterinarians are more likely to commit or attempt the suicide, to die by suicide, and carry it out. So there's a definite problem, and I don't know that any of these recruiters that you see in the hallways of the vet school have really addressed this sufficiently, because otherwise I think they would be doing a different sort of medicine, or at least offering and including integrative medicine and rehabilitation with longer exam times, longer treatment times. Because what is it that's burning people out? You have 5 minutes, maybe 10 minutes to come up with a diagnosis. How are you going to do that? And if you're not examining the animal, watching them walk, having a nice, gentle myofascial exam, if you're scaring them and they're shaking, and there's all kinds of noise, you're not going to get a decent and sufficient impression about what's going on with that animal. And so, what happens with that diagnosis? Well, you determine the treatment. If the diagnosis is wrong, then the treatment is going to be wrong and potentially damaging and potentially costly. And then who pays for that? Who pays for a TPLO complication where there's this very serious bone infection or breakage, or patellar tendon thickening, or just any of the many lists, we'll cover this in a later webinar, of things that happen after TPLO or spinal cord surgery, or who knows what it is, but who pays for that? And that is the client, who may already be so far in debt and strung out emotionally and not able to afford it. Why can't we have integrative medicine first? Rehabilitation that means rehabbing from the injury, and not implied that we are going to only have surgery and then have rehab. And that's another reason why we're teaching rehabilitation now from an integrated perspective at CuraCore, is we are not post-surgically oriented. We are helping the body heal itself. That's what we're oriented. But here's another finding. 52% from this study, they found 52% of veterinarians would not recommend a career in veterinary medicine because they're not having a good time. And again, this is a population that's being studied that is not doing the kind of medicine that can make you whole and can make you just really love what you do. Um, Again, from this population, the level of serious psychological distress in female veterinarians has increased since the last time they did a similar study, which was in 2017. So it's moved up from 6.3% to 8.1%. Just taking a look at the questions here. Okay, here's another one. So we are encouraged to push care credit so we can push additional testing that maybe the client cannot afford. If we push back or tell our superiors that we are uncomfortable with that, we get our hours cut and told we are somehow inferior. Do you know who I should talk to about opening my own practice? I just don't know where to start. Great question. So we're going to cover that as the beginning piece. Now, of course, so to cut to the chase, we're going to recommend a tiny or a small practice that you run, whether it's mobile or at a storefront. You can have low overhead, which is always how I practice medicine, from human to animal. It's like, I am not going to, well, aside from the 20 years I did spend at CSU teaching, but that was mostly part-time. And I still had control over my own schedule. I had a control over how much I worked and when I wanted to work in terms of seeing patients. So I was the only person that did acupuncture. So I had a very unique way of existing within the university environment. And if you can find that in academia, academia can be very, very stimulating. But what I'm talking about is being told when to show up, what to do. And here, you're even going to put people in credit, in more and more debt, so that you can satisfy the people in the corporate boardroom who say you're supposed to do this or that. That's just soul-sucking medicine. Um, so so if you can't exist within that, I mean, I don't encourage you to put up with it, and that's the difference between what we're approaching, how we're doing it here, and what you see in these studies. Like at one of the big meetings last year, that they're putting intentions in balloons and throwing them to their peers in other places in the room and reading them. I mean, these are all such band-aids. What needs to happen is a profound shift in how medicine is practiced, both in human and veterinary. So, how can we make veterinary medicine fun again, make it enjoyable, and make it life supporting, not only for us, but for our patients? So, what's being recommended by the AVMA and Merck in these papers? Okay, create a personal stress management plan. Um, is that going to make you feel better about ordering surgeries for animals that don't necessarily need it, that could be doing better with different approaches? Um, balance work with healthy personal activities. I mean, really? Work with a financial planner and discuss your debt. So much sidestepping around the actual problem. Oh, and veterinary practices too. You should discuss stress and mental health, and encourage your sick, tired, burnt out employees to seek help. Yeah, that's going to be great too. Even looking at this further in some of the some of the papers that we've put out there, if you do that, just know, check up on this for yourself in your own state board. But if you pursue that and you get a psychiatric diagnosis, what are you going to put on your license renewal if they should ask for that? So that's just something to consider. I'm not saying don't get help, but if you're being made sick because of what you're being told to do, how about you change what you're being told to do and you tell yourself what you want to do and what is right? So, in other words, no substantially meaningful changes in the type of medicine that veterinarians are asked or expected to perform is being advocated by the powers that be. And so, back to this issue of today's veterinary business, about how the big dogs recruit. So, just it was interesting to me to get into the head of some of this corporate stuff. And this vet recruiter that was being interviewed said, okay, what do veterinarians want? They want time off, okay, more pay, okay, and continuing education coverage so they get time to go and do it. Okay, nothing wrong with that, but you know how you can get it is being your own boss. So my question is to you, what are you willing to do for that time off and goods and a good salary and the ability to pursue continuing education? Are you being led to believe that your only choice is to sign on the dotted line? Now, here's some good news. According to the US Bureau of Labor Statistics, again, from this article, which was great to read because it gave me some good insight into the mainstream mentality. So, the veterinary profession is expected to grow 19% from 2016 to 2026. Of course, this was not considering COVID, but still, at least in the US, veterinarians are essential businesses and people love their animals and they've been adopting them like crazy. And some businesses are thriving, and there's going to be an economic shift, but still, one of the things I'd always heard is, when it comes to people's animals, they will do whatever, and that's why it's so important not to take advantage of them, and you know that. So, with the comparison of the veterinary profession growing, you know, nearly 3 times the rate of other average professions. That's a good thing, and that will add 50,000 jobs over the next 10 years. So, according to another financial news company, they have ranked the veterinary field as highly secure. So, this is where they looked at all kinds of occupations from the most to the least secure. And out of the 10 most secure professions, veterinarians, so your veterinary professional, ranked 7 out of 10. And then assistants, which included probably technicians and nurses, were ranked number 2 out of 10. So yeah, and they should be paid more as well and be given a lot more status. But anyway, as they say, that's almost a non-existent unemployment rate for our profession. So we're starting out, even pre-COVID, at a pretty good place. So, and then this recruiter says, es- estimates that there are currently between 3,500 and 5,000 open jobs right now. So what that says to me is that even if you, let's say you fail at doing your own thing, um, there's still a lot of jobs you can go back to, most likely. So you're going to have to figure it out for yourself. But if you can be in a location where there there are, the population is interested in getting their animal well. And that doesn't mean only a big city, because when I first got out of medical school, when I was covering practices, I covered practices, real small rural kinds of things, both in Ohio and Nebraska. And I had also known acupuncture by then, and so I didn't. I wasn't that familiar with extremely rural communities, but somebody came in and said, "I need you to do something about my back pain, doc." And I said, "Well, would you consider acupuncture?" Um, and they're like, "I don't care what you do, doc, just fix my back." And so even if it's a farmer or CEO of some company, and they want their dog better, and for whatever reason they know that surgery doesn't sit well with them, then they are going to probably look to you as a scientific integrative medicine practitioner. Also, if you do an expanded form of rehab like we are now teaching, you have a lot of tools to offer them, and they can always get surgery later. So, just like that, in a metaphorical fashion, you can always go to corporate later, most likely. But if you can scope out a place where you think you'll be happy and you make connections with maybe a surgical referral place, so you can start off and, okay, we'll do your post-ops. But as you get to know them, I mean, even CSU now has on their orthopedic surgery webpage, it's like you don't always need surgery for these problems, especially cruciate. So they're even coming now on board, recognizing that surgery is not the only option. And from our perspective, it should not be the first one unless proven otherwise. So we have good news on the job front, but um, are you going to be the one that goes for corporate just to fill a spot? And as I said, you can relax. You will most likely find a job if you wanted to jump on that. But will you enjoy it? Does it suit you? And will it support your soul? And based on the people that come through our course that have done that, um, the vehicle is mostly away from big box. And it's, I need to do something that really nourishes me. And they're so happy when they do that. So, pop quiz, true or false? Corporate practice, as opposed to my own small, low overhead, science based integrated medicine and rehab practice, may cause which of the following problems? Long working hours, mental and emotional exhaustion, stress from questionable practices, low work gratification, frustrating working conditions, pressure to increase sales, pressure to increase surgeries, pressure to increase tests, or I, all of the above. I think you know what the answer is. I. So, is there another way? We've been talking about that. Now, if you want to get a handout that goes along with this session, Spring Your Veterinary Career Back to Life, 3 Tried and Tested Roads to Happiness. And so at the bottom there, you can go directly there, or you can contact us at info@curacore.org, info at curacore.org, and we can send this to you. And it will have links and more about what I'm talking about today. But I do have in the handout to first shift the focus. So in the midst of chaos, there is opportunity, and that's from Sun Tzu, who had written from way, way back when, but The Art of War. But we're not talking about necessarily war, although some people have alluded to us at war with COVID. But it's just a way to have successful leadership, and to just give a good appraisal for yourself of what the situation is. And so when things are turbulent like this, as I started out by saying, this is a time for reflection, and it's a big opportunity for change. So we think back to what the magazine said, today's veterinary business, and okay, so let's say nowadays they want to make $100,000 a year. And if you think that I have to do that by being corporate, well, not true. And there are sites out there also. I think there's one. It's called Small Practice or something. They have a downloadable spreadsheet, but I hesitated to bring it up here because I'm always worried about downloading stuff from the internet. But essentially, it was just like you look at your expenses and your income and compare from there. So if you wanted to make $100,000 a year and have a tiny practice, so let's say you're doing acupuncture and manual therapy and laser therapy, and you know an informed scientific approach to botanical practice, and then you add integrative rehabilitation from our expanded osteopathic physical therapy kind of approach. Um, and you were happy with that, you're getting Prima certified, or any one of the above, or you just wanted to do vaccines or something, I don't know. Um, Probably not vaccines for this one, but let's say you were gonna say, okay, I'm going to make $100 an hour, whether that is $100 for your first visit, and not just or there can be a range, 75 to 125, whatever you think you need to make. I'm just coming up with an example because it's not unreasonable that I mean, this is actually on the low end. If you look at the range of integrative medicine practitioners, they would probably be charging 20 to 50, or even in some geographic locations, 100% more than that. Because it varies where you are. And we can't talk about prices for anything because it's price fixing conceivably, but I'm just pulling things out of the air. If you somehow did it so you're seeing patients, and this is it's a very low actual estimate amount, $100 per hour, and let's say you wanted to work 20 hours per week. So what do vets want? They don't want to work all the dang time. So you're going to work what's considered half time. So 20 times 100 equals $2,000 per week. And of course, yeah, you'll have to pay taxes. And I always like to say, before you get started, get a good business attorney. So there's startup costs, whatever, but you're working half time, right? If you can line up 20 or 30 patients. I mean, you will be building your practice, but you have ways to build that up. And you work 50 weeks and you made $100 per hour, worked 20 hours per week. To me, right, based on my iPhone calculator, it's $100,000. Okay? If corporate offers you a $100,000 position, that's not take home. There's going to be taxes there too. And then there's going to be costs for the shrink, for your incessant yoga classes that aren't doing what you need to do, for, hopefully they'll cover your sick time so you can go to the Zen monastery and figure out what you're doing. Okay. But anyway, so maybe if you wanted to make more, you work more, but you got to just establish yourself within the community. So there is that. And that takes a little bit of time. But if you're a nice, strong scientific practitioner, you're going to be much more attractive to referrals than others. And there are ways to set up. You don't necessarily need to have your own storefront. So sometimes people say to me, "Oh, but I need health insurance. I need an employer that gives me health insurance." I have never had health insurance coverage from an employer. Um, it's just maybe 2 years when I worked, if even that, when I had worked full time at CSU. That was all I worked full time at as during my whole 20 years there was always part time, and I did my own thing, and I had my own health insurance. And you can get health insurance like it matters how old you are and what's going on with you, but it's like $600 or something, give or take a few $100s. The AVMA used to offer really good health insurance for lower price. Maybe they're going to do that again. Um, so anyway, pay for it yourself. It's you do that, and you don't have to worry then if you decide to leave that you're not going to have health insurance. Buy it yourself. If you think you need a technician, it's nice to have a technician. I never had one when I was at CSU. I would sometimes have students that would help me in that role. But let's say you needed one. If you're only working half time, you can hire one for half time. You need make more, see more patients. But if you're still making 100,000 to start, how much is that going to carve out? How will I get referrals? once you're there, word of mouth, you can write a newspaper column. They can announce your opening of your practice. You can reach out to other area practices and animal facilities. You can attend, various shows, agility trials, things like that. And you can also share. If you wanted to have a storefront that you worked with somebody, you share costs that way, and that makes it even happier, and you have somebody else to bounce ideas off of. So let's take a moment and answer some questions. Here's one: is it really feasible to do a mobile practice? Yes, of course. One thing that I would say though now, with the era of COVID, we have more challenges. So do you want to be going into people's houses? I was anyway starting to be curious about, maybe there are things with mobile practice and you're going into other people's space. There, I is there an element of danger there? Yes, of course, there could be, unless you maybe met those clients first and then got to know them, and then you could do intermittent house calls, social distancing, physical distancing. I don't, however that's going to shake out. But here's another thing: you don't have to have a building. Um, a standalone building. And again, 80% of these normal practices are surgery, suites, and radiography. If you don't have that, your overhead goes so far down. It's like $10 or less for a box of acupuncture needles. You can get, little electrostimulators for a few $100s. You can get a laser device if you want one, from anywhere from several hundred to 25 or 30,000. Okay, so there's that, but you can make payments if you want the high one. Um, but there are ways to reduce your overhead. There's also, in terms of the vet mobile thing, can you do it all mobile? If you have, let's say, a van or some kind of structure that you could have those animals brought out so they don't have to go to another location. They're just brought out in front and in a great little environment that you create in your own mobile practice, your vehicle. Then you're really solving a lot of problems by doing that, and you can keep control over the hygiene and sanitation and all that. Or you could rent space out of practice, and we see a lot of our people doing that as well, that they might not want to be part of that general practice thing or only do that part-time, but then they can use a room that's just dedicated for their type of practice, and it's quiet, and it's, you have to not be in the noisy area and all that. So that's an option too, low overhead. But I'm scared. To, okay, so talk to others that have done it and who are thriving. And that's where I want to point you to our YouTube channel, the CuraCorp YouTube channel, and see videos of our, what we call docs, who are our teachers, doctor observers, and coaches, like Alyssa and like Steve and Tara, and actually, all these individuals and more even, that we have Alan, who is an equine practitioner, and Misha and Sean, and so on, and Nancy with bond-centered practice, that you have these people that you can see how they've done it, whether they include some general practice or they've just gone fully integrative. So these 3 steps: you have a tiny or low overhead small practice, you really get to know your clients, you determine how long you want to spend with them, whether it's an hour for the first visit and a half hour for follow-ups. You can add things like fear-free and cat-friendly. Hello. But what happens when the client leaves? So that's where it's like, it can look all good from the outside, but if it's not good in the inside, in behind, after the client leaves, that's just show. So we really, for it to thoroughly be fear-free, and if you have cats, cat-friendly, then there should be a type of medicine that is consistent with that, which means that you are addressing pain, not necessarily with a lot of drugs, but you are addressing pain either with manual therapy, with laser therapy, with acupuncture, however you're doing it, maybe modification of the home environment, maybe modification of exercise, that you have a mentality about you that is geared to nourishing that client, that animal's well-being from within, and removing the obstacles to self-healing, which includes using acupuncture or photomedicine or, again, manual therapy, maybe botanicals, maybe it's an integrative rehab thing. It's not like you're going to do that for everybody that walks in the door, but even if they have eye problems, there's ways to treat that with acupuncture. You can see what kind of triggers are going on in the home environment. You can encourage some massage at home. There's so much that should be included as first line care that would make you a much happier practitioner, whether you're in a small practice or a big multi specialty practice. So here's another question: why isn't the ABMA advocating for this type of practice? Yeah, you asked me. Maybe somebody somewhere might say, follow the money. They might say, who supports the ABMA financially? They might say, who is speaking for the ABMA, and are they aware of these other practices? Um, they continue, we are an AHA accredited practice, and our standards of good care and practices state that we do testing that gives us the best diagnosis. If going solo or mobile is the way to a happier career, why isn't that being promoted by our peers? Yeah, well, why isn't the best type of diagnosis being promoted by schools maybe too? So you go to vet school and you learn how to do certain thing. Did any of you that are in vet school now, did you learn a myofascial exam in your practice? Did you learn how to watch an animal walk? Did you learn about the interactions and how looking at the whole family kind of dynamic, and see what's the level of fear, anxiety, and stress there? Have you learned about how to diminish stress in cats, which is not to be doing a lot of coming and going? Did you learn about how to get a dachshund that's down, seems to have a spinal cord injury, up without surgery, and using integrated medicine practices and rehab that reduce the secondary pathophysiology of the spinal cord, where you told that in neurology? I mean, it just goes back. And if you can follow the money through these large structural institutions, you can also follow the education where from the get-go we're being encouraged to be reliant on altering the chemistry, so pouring drugs in, and doing surgery, drugs and surgery. That's the mainstay. And that's not how medicine needs to happen. It's just a habit pattern, and it's probably financially rewarding for certain institutions and for those companies that have the largest mouthpiece, which is why I got a big mouth. And I'm going to use it here, and I encourage others to speak out as well. Um, Yes, and Luana, thank you for writing. I think it is important to research your state or province guidelines to know what various types of veterinary practices require for licensing purposes. Now that's very good, especially for the time I had spent in Canada. There are specific guidelines on. I mean, it was a bit. I guess I can say it now because I'm not there. I think I shouldn't use the word insane. Um, let's see, overmuch, I think, overmuch regulation in terms of whether you can prescribe drugs if you're a primarily rehab practice. I don't know. It was just like, oh, this is not comfortable for me, and this is not necessarily best for the animals, but definitely, Luana, yes. You find out what's in your state, like as far as when you have a practice. And that's part of having a business attorney that knows about veterinary medicine types of practices. What do you need to do? Is there informed consent stuff? So I'm giving you like kind of an over thing, but you need to know what the specific guidelines are. And especially when you have something mobile, there's oftentimes things that you need to lock up drugs if you're going to have them, just for cleanliness things, because people fall off the rails, and that's not good. So you need minimum basic, practices. Um, how about maybe you could rent a room in a brick and mortar vet practice when they are closed in the evening or Sunday? So, hey, that is a perfect idea. Wow, that's great. Yeah, you have you have from the time you wake up until, let's say, 4 p.m. to meditate, to ride your bike, to be with your kids or your animals, whatever you want, and then you go to work when everybody else is available and they're done with their work. But you've had all day to play. You went up in the mountains, you had a little picnic for yourself, you made lunch for someone or whatever, and then according to whatever COVID standards are, but you rent a brick and mortar. Yeah, nobody else is there, so you're limiting you're having limited social distancing, and yeah, so you work on Sundays. So who cares? I think that's fine. That's a really beautiful idea. Thank you for that. Getting some really good questions here. Okay. Oh, okay. Luann, again, it is really important to be involved in state and province associations. Oh, that's great too. As they set the professional guidelines on how to practice medicine. Spot on. Right, right. So let's see. We follow the money for big organizations. Also, we follow who is incentivizing even. No, so there's the big corporatization of academia. So which faculty are being paid by which surgery supply or drug company in their research or whatever? So where are they compromised in terms of what they want to teach you? And they have so many things to think of. So why is veterinary and medical education the way it is? Who's running the show? Who is incentivizing whom? And then, get on your state boards, get in your vet medical associations. We need to have our voice in all different levels. And spot on, Luana, thank you for that. So there's some activism that could happen. But of course, if you're seeing your patients on weekends and Sundays, you can spend as much of the day as you want on activism. And that is a good thing. So moving forward, the goal here is to bring more love, kindness, creativity, and science-based integrative medicine into your work. You can envision feeling sane and happy every day. This could be for you, where you make your own hours and you form lifelong bonds with your patients and your clients. So many of us that are in this field for a long time, we talk about the generations of patients that we've had from a certain client, and we know the client through their life story, and then we see their animals, the ones that come after the first ones you treat, and just it's a great way to live life, professionally and personally. And then you can talk to others about how they have achieved both deep fulfillment and financial success by remaining independent and free to make medical decisions based on best practices. So if you have questions, feel free to contact us. If you want to talk to me, then email me anytime at narda@curacor.org. If you want a handout of any kind or anything about our programs, mail it to me or info@curacor.org. And here's a note from one of our listeners. Thank you, Narda. Because I took your acupuncture course, I am the only one in 250 miles that does acupuncture. I am in demand and referred to by many area veterinarians. I just want others to know they can do it too. I'm going to cry. Okay, well, thank you. We'll see you next time, and we will have another baby to meet. We didn't talk much to this one, but we'll talk about cat medicine too, and we have catupuncture coming up in the summer. So bye-bye for now. See you next Wednesday.